What are the implications of the right to privacy for patients, and how should physicians manage patient confidentiality? Answer: the right to privacy is fundamental in healthcare, protecting patients from unauthorized disclosure of their personal health information. Key implications for physicians include confidentiality obligations. Physicians are legally required to maintain the confidentiality of patient information as outlined in Article L1104 of the Public Health Code. This includes safeguarding medical records and communications, informed consent for disclosure. Physicians must obtain patient consent before sharing information with third parties unless required by law. E.g., mandatory reporting of abuse. Data security measures. Implementing robust security protocols to protect patient data from unauthorized access or breaches is crucial. This may involve using secure electronic medical record systems and training staff on confidentiality practices. Legal consequences. Violating patient confidentiality can lead to disciplinary actions by the Ordre des Médecins, civil lawsuits, and potential criminal charges depending on the severity of the breach. By prioritizing patient privacy, physicians can foster trust and promote better healthcare outcomes. Describe the process and legal requirements for obtaining informed consent from a patient before a surgical procedure. Answer: obtaining informed consent is a legal and ethical obligation for physicians, especially before surgical procedures. The process includes disclosure of information. The physician must provide comprehensive information about the procedure, including its purpose, risks, benefits, and alternatives. This should be tailored to the patient's level of understanding. Assessment of understanding. Physicians should ensure that patients comprehend the information provided, encouraging questions and clarifications. Voluntariness. Consent must be given freely without coercion or undue pressure. Physicians must assess the patient's mental capacity to make informed decisions. Documentation. A written consent form should be signed by the patient, documenting their agreement to proceed with the procedure. This form should include details about the procedure and acknowledge the information provided. Right to withdraw consent. Patients retain the right to withdraw consent at any time before the procedure, which physicians must respect. Failure to obtain proper informed consent can result in legal claims of battery or negligence, highlighting the importance of this process in medical practice. What legal protections do physicians have when providing care in emergency situations, and what are the limits of these protections? Answer: in emergency situations, physicians are generally afforded certain legal protections, including Good Samaritan laws. These laws protect healthcare providers from liability when they render emergency care in good faith and without compensation, provided they act reasonably and within their scope of practice. Duty to act. Physicians are encouraged to assist in emergencies, but they must adhere to established protocols and standards of care. Acting outside of these standards can negate the protections offered by Good Samaritan laws. Limits of protection. Protections may not apply if the physician's actions are grossly negligent or reckless, or if they have a pre-existing duty to the patient in question. Documentation. Physicians should document the circumstances of the emergency, their actions, and the outcome to provide a clear account that may be useful in case of legal scrutiny. Understanding these protections helps physicians navigate their responsibilities while minimizing legal risks in emergency situations. Discuss the importance of ethical considerations in the physician-patient relationship and the potential consequences of ethical breaches. Answer: ethical considerations are paramount in the physician-patient relationship, impacting trust, treatment outcomes, and professional integrity. Key aspects include patient-centered care. Physicians must prioritize the patient's best interests, respecting their values, preferences, and needs in treatment decisions. Honesty and transparency. Ethical practice requires physicians to communicate honestly about diagnosis, treatment options, and potential outcomes. This transparency fosters trust and strengthens the therapeutic relationship. Conflicts of interest. Physicians must avoid situations where personal interests may compromise patient care, such as accepting gifts or incentives from pharmaceutical companies. Consequences of breaches. Ethical breaches can lead to disciplinary actions by the Ordre des Médecins, legal repercussions, loss of licensure, and damage to the physician's reputation. Additionally, breaches can erode patient trust, impacting care quality. Understanding and adhering to ethical principles is crucial for maintaining professional conduct and ensuring high standards of patient care. What are the legal responsibilities of physicians regarding the management of medical records and patient data? Answer: physicians have significant legal responsibilities concerning the management of medical records and patient data, including record keeping. Physicians must maintain accurate, complete, and up-to-date medical records, as mandated by Article L1117 of the Public Health Code. These records should reflect the patient's medical history, treatment plans, and any communications. Data security. Implementing adequate security measures to protect patient records from unauthorized access or breaches is essential. This includes both physical and electronic safeguards. Retention period. Medical records must be retained for a legally mandated period, typically 10 years from the last patient visit, after which they should be securely disposed of. Patient access. Patients have the right to access their medical records under the law. Physicians must facilitate this access while ensuring that sensitive information is protected. Legal consequences. Failure to comply with record-keeping and data management regulations can result in legal actions, penalties, and professional disciplinary measures. Analyze the role of the National Council of the Order of Physicians in regulating medical practice and protecting public health. Answer. The National Council of the Order of Physicians plays a vital role in regulating medical practice and safeguarding public health through several key functions. Licensure and registration. The Council is responsible for licensing physicians and ensuring that only qualified practitioners are permitted to practice medicine. Disciplinary actions. The Council investigates complaints against physicians and has the authority to impose disciplinary measures, including warnings, suspensions, or expulsions, to maintain professional standards. Continuing education. The Council promotes ongoing professional development through mandatory continuing education programs, ensuring physicians remain informed about advancements in medicine and changes in regulations. Public health advocacy. The Council engages in public health initiatives, collaborating with governmental and non-governmental organizations to address public health challenges and promote preventive care. Ethical guidelines. The Council establishes and enforces ethical guidelines for medical practice, helping to ensure that physicians uphold high standards of care and professionalism. What are the legal implications of telemedicine practices in France, particularly regarding patient consent and data protection? Answer. Telemedicine practices in France carry specific legal implications related to patient consent and data protection, including informed consent. Physicians must obtain informed consent from patients before conducting telemedicine consultations. This includes informing patients about the nature of the consultation, potential risks, and limitations of telemedicine. Patient privacy. Physicians must adhere to data protection regulations under GDPR and the Public Health Code. This includes ensuring secure platforms for telemedicine, safeguarding patient information, and obtaining explicit consent for data processing. Medical liability. Physicians conducting telemedicine consultations must maintain the same standard of care as in-person visits. Failure to meet this standard can result in liability for malpractice if a patient suffers harm. Reimbursement and coverage. Physicians should be aware of the legal frameworks governing reimbursement for telemedicine services, as these may differ from traditional in-person visits. Regulatory compliance. Telemedicine practices must comply with all relevant medical regulations, including licensing and professional standards, to ensure legitimacy and protect patient rights. Discuss the ethical considerations surrounding end-of-life care and the physician's role in assisting patients and families. Answer. End-of-life care presents complex ethical considerations for physicians, including autonomy and informed choices. Physicians must respect patients' wishes regarding end-of-life care, including their right to refuse or discontinue treatment. This requires clear communication and obtaining informed consent. Palliative care. Physicians should prioritize palliative care, focusing on alleviating suffering and improving the quality of life for patients with terminal illnesses. This approach emphasizes symptom management and psychological support. Advanced directives. Physicians should encourage patients to establish advanced directives outlining their preferences for end-of-life care. This ensures that patients' wishes are honored even if they cannot communicate them later. Family involvement. Involving family members in discussions about end-of-life care is essential, as they may play a critical role in supporting the patient and making decisions on their behalf. Legal protections. Physicians must be aware of the legal frameworks governing end-of-life care, including laws related to assisted dying, to ensure compliance while providing compassionate care. What are the consequences for a physician found guilty of practicing without a valid medical license in France? Answer. Practicing medicine without a valid medical license in France carries severe consequences, including criminal penalties. Physicians found guilty of unauthorized practice may face criminal charges under Article 432(2) of the Penal Code, which can result in fines and imprisonment, civil liability. Unlicensed physicians may be held liable for malpractice claims if patients suffer harm due to their actions, potentially leading to significant financial compensation awarded to affected parties. Disciplinary actions. The Ordre des Médecins can initiate disciplinary proceedings against individuals practicing without a license, resulting in sanctions such as suspension or permanent removal from the medical register. Reputational damage. Being found guilty of practicing without a license can severely damage a physician's reputation, impacting their ability to work in the medical field in the future. Public health risks. Unlicensed practice poses risks to public health, as unqualified individuals may provide inadequate or harmful medical care, further justifying strict legal measures against such practices. How should a physician approach the issue of mandatory reporting of suspected abuse or neglect in patients? Answer. Physicians have a legal and ethical obligation to report suspected abuse or neglect, which includes recognizing signs of abuse. Physicians should be trained to identify potential indicators of abuse or neglect in patients, which may include physical injuries, behavioral changes, or inconsistent explanations of injuries. Mandatory reporting laws. Under French law, physicians are required to report suspected cases of abuse or neglect to appropriate authorities, such as child protection services or law enforcement, depending on the patient's age and circumstances. Documenting findings. Physicians should meticulously document their observations, discussions with the patient, and any relevant information to support the reporting process. Maintaining confidentiality. While mandatory reporting is required, physicians must also respect patient confidentiality. They should communicate to the patient when appropriate that a report will be made to protect their safety. Support for victims. Physicians should provide or recommend appropriate support services for patients who have experienced abuse, helping them navigate the resources available to them. What are the legal criteria for determining a physician's professional incompetence, and how is this addressed by medical boards? Answer. Legal criteria. Standard of care. A physician is considered professionally incompetent if their performance falls below the accepted standard of care in the medical community. This includes deficiencies in knowledge, skills, and judgment that result in patient harm. Frequency of incidents. Repeated incidents of substandard care rather than a single error may indicate incompetence. Boards assess patterns of behavior, not isolated events. Peer review findings. Medical boards often rely on peer reviews, which evaluate the physician's performance against established benchmarks, addressed by medical boards. Investigations. Upon receiving complaints about a physician's competence, medical boards conduct investigations that may involve interviews, reviews of patient records, and consultations with medical experts. Sanctions. If incompetence is established, boards have the authority to impose sanctions ranging from mandatory education or retraining to suspension or revocation of the medical license. They may also require monitoring of the physician's practice. What is the role of the physician in end-of-life decision-making, particularly regarding do not resuscitate, DNR orders, and euthanasia? Answer. DNR orders. Patient autonomy. Physicians must respect patients' wishes regarding DNR orders, which should be documented clearly in the patient's medical record. Communication. Effective communication with patients and their families about the implications of a DNR order is essential, ensuring that patients understand what it entails. Legal compliance. Physicians should ensure DNR orders comply with local laws, which may require specific forms or documentation to be valid. Euthanasia. Legal framework. The legal status of euthanasia varies by jurisdiction where it is legally. Certain countries or states, physicians must strictly adhere to guidelines that often require informed consent. Patients must be informed about their options and the consequences of their decisions. Assessment. Psychosocial assessments to confirm the patient's mental competency and understanding of their condition. Waiting period. Some jurisdictions require a waiting period between the request and the procedure to ensure the decision is consistent and voluntary. Ethical considerations. Balancing autonomy and care. Physicians must navigate the ethical landscape of preserving life while respecting patients' wishes regarding their suffering and end-of-life care. Consultation with ethics committees. In complex cases, physicians may consult with institutional ethics committees to guide their decisions. What are the legal obligations of physicians regarding patient confidentiality, and in what circumstances can confidentiality be breached? Answer. Legal obligations. Confidentiality principle. Physicians are bound by the principle of confidentiality, ensuring that patient information is kept private unless the patient consents to disclosure. HIPAA compliance. In jurisdictions like the US, physicians must comply with the Health Insurance Portability and Accountability Act (HIPAA), which sets stringent rules for protecting health information. Circumstances for breaching confidentiality. Public health risks. Physicians must report cases of communicable diseases such as tuberculosis or COVID-19 to public health authorities to prevent outbreaks. Legal obligations. In instances of court orders or subpoenas, physicians may be required to provide patient information. However, they should disclose only the information requested and protect the patient's privacy as much as possible. Imminent risk of harm. If the patient poses a credible threat of harm to themselves or others, physicians are mandated to report this to appropriate authorities to prevent violence or suicide. How should a physician handle conflicts of interest in medical practice, and what are the consequences of failing to disclose these conflicts? Answer: handling conflicts of interest. Full disclosure. Physicians must disclose any financial relationships with pharmaceutical companies, medical device manufacturers, or other entities that could influence their clinical judgment to patients and relevant stakeholders. Written policies. Many healthcare institutions have policies requiring physicians to document potential conflicts of interest in writing and review them with ethics boards or compliance officers. Consequences of non-disclosure. Disciplinary actions. Failing to disclose conflicts of interest can lead to disciplinary actions by medical boards, including fines, suspension, or revocation of licensure. Legal liability. Patients may file malpractice lawsuits based on claims of undue influence or deceptive practices due to undisclosed conflicts, leading to financial penalties and reputational damage for the physician. Loss of trust. Non-disclosure can erode patient trust and damage the physician-patient relationship, negatively impacting patient care and adherence to treatment. What are the legal and ethical guidelines for conducting clinical research involving human subjects? Answer: legal guidelines. Informed consent. Before enrolling participants, researchers must obtain informed consent, ensuring that participants are fully aware of the study's purpose, procedures, risks, and benefits. Ethics committee approval. Studies must be reviewed and approved by an institutional review board or ethics committee to ensure that they meet ethical standards and protect participants' rights. Ethical guidelines. Respect for persons. Researchers must treat participants as autonomous individuals capable of making informed decisions, and they must protect those with diminished autonomy. Beneficence and non-maleficence. Researchers should minimize risks and maximize benefits to participants. Studies must be designed to produce valid and useful results without exposing participants to unnecessary harm. Justice. Fair selection of participants is crucial. Vulnerable populations should not be exploited, and benefits and burdens of research should be equitably distributed. In what situations is a physician required to report to public authorities, and what are the legal consequences of failing to report? Answer: situations requiring reporting. Child or elder abuse. Physicians are mandated reporters and must report suspected abuse or neglect to appropriate authorities such as Child Protective Services or Adult Protective Services. Infectious diseases. Many jurisdictions require physicians to report cases of certain infectious diseases, e.g. measles, HIV, to public health authorities to enable disease tracking and prevention measures. Gunshot or knife wounds. Healthcare providers must report specific injuries such as gunshot wounds to law enforcement to assist in criminal investigations. Legal consequences of failing to report. Criminal penalties. Failing to report mandatory cases of abuse or neglect can lead to criminal charges against the physician, including fines or imprisonment. Professional disciplinary actions. Medical boards can impose sanctions, including suspension or revocation of a medical license for failing to comply with reporting laws. Civil liability. Physicians may face lawsuits for damages if a failure to report results in further harm to the patient or others. What are the legal and ethical responsibilities of physicians regarding telemedicine, particularly with regard to patient consent and data security? Answer: legal responsibilities. Informed consent. Physicians must obtain informed consent from patients before conducting telemedicine consultations. Patients should understand the nature of the consultation, potential risks, limitations of telehealth, and alternatives to in-person visits. Licensure compliance. Physicians must be licensed in the state where the patient is located at the time of the consultation, complying with local regulations regarding telemedicine practice. Data security. Confidentiality. Physicians must implement safeguards to protect patient data during telehealth visits, ensuring that communication platforms comply with privacy laws like HIPAA. Secure platforms. Use of secure, encrypted telemedicine platforms is essential to protect patient information from unauthorized access and breaches. Ethical responsibilities. Quality of care. Physicians should maintain the same standard of care in telemedicine as in traditional settings, ensuring effective diagnosis and treatment despite the medium used. Equity of access. Physicians must be aware of and address disparities in access to technology that may affect certain populations, ensuring all patients can benefit from telehealth services. Relevant law. Telemedicine is governed by state-specific telehealth laws and regulations, which outline requirements for practice, consent, and data security. What is the principle of therapeutic privilege in medical practice, and when is it legally justified? Answer. Therapeutic privilege definition. Therapeutic privilege allows physicians to withhold certain information from patients when disclosing it could cause significant harm or distress, particularly in situations where the patient may not be able to process the information effectively. Legal justification. Patient safety. Therapeutic privilege may be legally justified when providing full disclosure could lead to severe emotional or psychological distress that could negatively impact the patient's health. Immediate threat to life. If revealing information could lead a patient to make hasty decisions, e.g., refusing treatment that threaten their life, withholding information might be considered justifiable. Ethical considerations. Balance of autonomy and beneficence. Physicians must carefully weigh the benefits of withholding information against the ethical duty to respect patient autonomy. It should be a rare exception rather than a common practice. Documentation. If therapeutic privilege is invoked, it is crucial for the physician to document the rationale behind the decision and the potential risks of disclosing the information. Relevant law. While not universally codified, therapeutic privilege is discussed in medical ethics and legal guidelines, emphasizing the need for careful consideration of when it may be applied. How do medical malpractice laws protect patients, and what are the common defenses used by physicians in malpractice cases? Answer. Patient protection through malpractice laws. Legal recourse. Medical malpractice laws provide patients with the right to seek compensation for injuries or harm resulting from negligent medical care. These laws aim to ensure accountability in healthcare practices, standards of care. Malpractice laws help establish and enforce standards of care, ensuring that healthcare providers meet the expected level of skill and diligence in their practice. Common defenses used by physicians. Standard of care defense. Physicians may argue that they adhered to the accepted standard of care and that their actions were consistent with what other competent practitioners would have done in similar circumstances. Informed consent. Physicians may defend themselves by demonstrating that they provided adequate information to the patient, who made an informed decision regarding their treatment. Causation defense. Physicians can assert that the injury or harm suffered by the patient was not a direct result of their actions or omissions, potentially pointing to pre-existing conditions or alternative causes for the injury. Comparative negligence. This defense involves demonstrating that the patient's own actions contributed to the harm, reducing the physician's liability. Relevant law. Medical malpractice is governed by state-specific laws, including statutes of limitations for filing claims, which set the time limits within which patients must pursue legal action. What ethical principles guide the practice of genetic testing and counseling, particularly in regard to informed consent and potential discrimination? Answer. Ethical principles. Autonomy. Patients must have the right to make informed choices about genetic testing, including understanding the implications of the results on their health and family. Beneficence. Genetic testing should be conducted for the benefit of the patient with the goal of improving health outcomes or providing necessary information for family planning. Non-maleficence. Physicians must ensure that genetic testing does not cause harm, including psychological distress from potentially distressing results or misunderstanding of the implications. Informed consent. Comprehensive information. Physicians must provide patients with detailed information about the nature of the test, the potential outcomes, risks and benefits, and the possible impact on family members. Understanding and voluntariness. Patients should comprehend the information provided and make a voluntary decision without coercion. Potential discrimination. Legal protections. Laws such as the Genetic Information Non-Discrimination Act, GINA in the US, prohibit discrimination based on genetic information in employment and health insurance, safeguarding patients against adverse effects stemming from test results. Ethical vigilance. Healthcare providers must remain vigilant against discrimination in their practice, ensuring that genetic information is used ethically and without prejudice against patients or their families. Relevant law. Genetic testing and counseling are regulated by a combination of healthcare laws, ethical guidelines, and specific statutes like GINA that protect individuals from discrimination based on genetic information. What are the key components of informed consent, and why is it essential in medical practice? Answer. The key components of informed consent include disclosure. The physician must provide comprehensive information about the proposed treatment, including its purpose, risks, benefits, and alternatives. This information should be presented in a manner that the patient can understand. Understanding. The patient must demonstrate an understanding of the information provided, including the implications of their choices. Physicians should encourage questions and clarify any uncertainties. Voluntariness. The patient's decision must be made voluntarily, without coercion or undue pressure from healthcare providers, family members, or other external factors. Competence. The patient must have the mental capacity to make informed decisions about their medical care. If a patient lacks capacity, a legally authorized representative must provide consent. Consent. The patient must provide explicit agreement to proceed with the proposed treatment, which can be verbal or written, depending on the nature of the procedure. Importance of informed consent. Ethical obligation. Informed consent respects patient autonomy, ensuring that individuals have the right to make decisions regarding their own healthcare. Legal protection. Obtaining informed consent protects healthcare providers from legal liability and claims of malpractice. It demonstrates that the physician has engaged the patient in the decision-making process. Improved outcomes. Informed patients are more likely to be engaged in their treatment, leading to better adherence, satisfaction, and health outcomes. Informed consent is a foundational principle of ethical medical practice, promoting trust and transparency in the physician-patient relationship. Discuss the ethical implications of genetic testing and screening in healthcare. Answer. Genetic testing and screening have significant ethical implications, including autonomy and informed consent. Patients should have the right to make informed decisions regarding genetic testing. This includes understanding the implications of the test results for themselves and their family members. Ensuring informed consent is crucial, as patients may feel pressured to undergo testing based on family history or medical recommendations. Privacy and confidentiality. Genetic information is highly sensitive, and healthcare providers must protect patient privacy. Patients should be assured that their genetic data will remain confidential and only be shared with authorized personnel. Breaches of confidentiality can lead to discrimination or stigmatization. Psychological impact. The results of genetic tests can significantly affect patients and their families. Positive results for genetic conditions may lead to anxiety, guilt, or changes in family dynamics. Healthcare providers should offer counseling and support to help patients cope with the emotional consequences. Discrimination and stigma. There is a risk that individuals may face discrimination from employers or insurers based on their genetic predisposition to certain diseases. Ethical considerations include advocating for policies that protect individuals from genetic discrimination. Equity of access. Ethical concerns arise regarding equitable access to genetic testing and counseling services. Disparities in access may exist based on socioeconomic status, geography, or healthcare system inequities. Healthcare providers should strive to promote fairness in access to genetic services. Overall, genetic testing presents unique ethical challenges that require careful consideration of autonomy, privacy, and the potential impact on individuals and their families. What are the ethical challenges associated with telemedicine, particularly regarding patient privacy and the quality of care? Answer. Telemedicine presents several ethical challenges, particularly concerning patient privacy and the quality of care. Patient privacy and confidentiality. Ensuring the security of patient data during telemedicine consultations is paramount. Ethical challenges arise when providers use unsecure platforms or fail to obtain informed consent regarding data sharing. Providers must adhere to HIPAA and other relevant data protection regulations to safeguard patient information. Quality of care. Telemedicine may limit the physician's ability to conduct comprehensive physical examinations, potentially impacting the quality of care. Physicians must ensure that they can provide adequate assessments and interventions through virtual visits. If a patient's condition requires an in-person evaluation, physicians have an ethical obligation to recognize and recommend appropriate referrals. Informed consent. In the context of telemedicine, obtaining informed consent can be complex. Patients must understand the differences between in-person visits and telemedicine, including potential risks and limitations. Healthcare providers should communicate clearly about the nature of the virtual care provided. Equitable access. Ethical considerations arise regarding access to telemedicine services. Not all patients may have the necessary technology or internet access to participate in virtual consultations, creating disparities in care. Providers should work to ensure that vulnerable populations are not excluded from telemedicine services. Continuity of care. Maintaining continuity of care can be challenging with telemedicine, especially if patients see multiple providers for different issues. Ethical responsibilities include coordinating care among healthcare providers and ensuring that patients receive comprehensive support. Addressing these ethical challenges requires proactive measures to protect patient privacy, ensure quality care, and promote equitable access to telemedicine services. A physician discovers that a patient has been misusing prescription medication. The patient is a single parent who is struggling financially and believes that the medication is essential for their ability to work and care for their children. What ethical considerations should the physician take into account, and what actions should they consider? Answer: in this situation, the physician should consider several ethical considerations. Patient welfare. The physician must prioritize the well-being of the patient while also considering the potential risks associated with misuse of medication. Assessing the patient's medical needs and any underlying issues leading to misuse is critical. Autonomy and support. While the physician must respect the patient's autonomy, they should also provide support and resources to help the patient address their substance misuse. This could include referrals to counseling or addiction services. Safety and responsibility. The physician has an ethical obligation to ensure patient safety. If the patient's misuse of medication poses a risk to themselves or others, the physician may need to take appropriate action, which could involve discussing the potential need for altering the prescription. Confidentiality. The physician should approach the situation delicately to maintain the patient's trust while ensuring that any necessary interventions are carried out. They should also be aware of legal obligations concerning reporting in cases of significant risk. Economic and social factors. Understanding the socioeconomic factors contributing to the patient's situation is essential. The physician should explore options for assistance, including community resources that could help alleviate financial burdens. Actions to consider. Engage in a candid discussion with the patient about their medication use, providing a safe space for the patient to share their challenges. Offer support and alternatives for managing their condition, including non-pharmacological approaches or referring the patient to counseling or social services. If necessary, consider adjusting the medication regimen to reduce the risk of misuse while still addressing the patient's health needs. The physician should strive to balance compassion, support, and ethical responsibility in addressing the patient's situation. What are the ethical implications of physician-assisted suicide, and how do they differ from euthanasia? Answer: physician-assisted suicide, PAS, and euthanasia raise significant ethical implications, particularly concerning autonomy, beneficence, and the sanctity of life. Physician-assisted suicide, PAS, definition. In PAS, a physician provides the means for a patient to end their own life, typically through a prescription for lethal medication, which the patient self-administers. Autonomy. PAS emphasizes the patient's right to make decisions about their own life and death, reflecting respect for autonomy. Advocates argue that individuals with terminal or debilitating conditions should have the option to choose death to avoid suffering. Beneficence and non-maleficence. Physicians face ethical challenges in balancing the desire to alleviate suffering, beneficence, against the commitment to do no harm, non-maleficence. Euthanasia. Definition. Euthanasia involves a physician directly administering medication to end a patient's life, typically at the patient's request. This can be voluntary, with the patient's consent, or non-voluntary, without the patient's explicit consent. Moral considerations. Euthanasia raises more complex moral questions as it involves active intervention to end a life. Ethical debates focus on the implications for the sanctity of life and the potential for abuse or coercion, particularly among vulnerable populations. Legal status. The legality of euthanasia varies significantly by jurisdiction, with some places allowing it under strict conditions, while others prohibit it entirely. This legal framework can influence ethical discussions surrounding both PAS and euthanasia. Key differences. Agency. PAS maintains patient agency, allowing individuals to take their own lives, while euthanasia involves direct physician action to end life. Legal and ethical perspectives. The ethical and legal acceptability of each practice varies, with PAS often seen as a more acceptable option in jurisdictions that permit assisted dying, while euthanasia remains more contentious. Both PAS and euthanasia require careful consideration of ethical principles, legal frameworks, and the potential societal implications of normalizing such practices. Discuss the ethical considerations surrounding placebo treatments in clinical practice. Answer: placebo treatments raise several ethical considerations in clinical practice, primarily revolving around informed consent, beneficence, and deception. Informed consent. Patients have the right to know what treatment they are receiving and the potential benefits and risks involved. Using a placebo without patient awareness can violate this principle, as it involves withholding information that could influence their decision-making. Ethical practice necessitates that patients are adequately informed about the nature of their treatment, including whether they may receive a placebo. Deception and trust. Administering a placebo may require some level of deception, which can undermine the trust between patients and healthcare providers. Trust is crucial in the physician-patient relationship, and any form of deception can damage this rapport. If patients discover they were given a placebo without their knowledge, it could lead to feelings of betrayal and resentment, potentially harming their willingness to seek care in the future. Beneficence and non-maleficence. The ethical principle of beneficence emphasizes the importance of acting in the best interest of the patient. While some studies suggest that placebos can elicit a therapeutic response, the potential for psychological harm or failure to address the underlying condition raises concerns. Additionally, if a placebo fails to provide relief for a patient's condition, it could lead to a delay in receiving effective treatment, which could exacerbate their health issues. Clinical trials and research. Placebos are often used in clinical trials to assess the efficacy of new treatments. In this context, ethical considerations include ensuring that participants provide informed consent and understand the possibility of receiving a placebo instead of active treatment. Researchers must also consider the ethical implications of withholding potentially beneficial treatments from participants in the placebo group, particularly in studies involving serious or life-threatening conditions. The hospital is experiencing a shortage of ventilators during a public health crisis. The medical team must decide how to allocate the limited resources among patients in critical condition. Discuss the ethical principles that should guide their decision-making process. Answer: in this scenario, the medical team should consider the following ethical principles to guide their decision-making process regarding ventilator allocation. Justice, fairness in resource allocation is essential. The team should strive to distribute ventilators based on objective criteria rather than personal biases, ensuring equitable access for all patients regardless of socioeconomic status, race, or other factors. Developing a clear framework for prioritizing patients' e.g., likelihood of survival, age, and overall health status can help uphold the principle of justice. Beneficence and non-maleficence. The medical team has an obligation to maximize benefits and minimize harm. This involves assessing which patients are most likely to benefit from ventilator support and have a higher chance of recovery. It is crucial to consider the potential outcomes of allocating resources to one patient over another, ensuring that decisions are made to improve overall patient health. Utility. The principle of utility emphasizes maximizing overall benefit for the greatest number of patients. In this context, the team should evaluate which patients have the best prognosis and will derive the most significant benefit from the limited resources. This might involve prioritizing younger patients or those with fewer comorbidities, reflecting a utilitarian approach to resource allocation, transparency and communication. The decision-making process should be transparent, and the rationale for ventilator allocation should be communicated clearly to patients, families, and the broader community. This fosters trust and understanding during a challenging situation. Prioritization of healthcare workers. Ethical considerations may also extend to prioritizing healthcare workers who are essential to managing the crisis and maintaining healthcare systems. Protecting their health may ultimately benefit patient care. What ethical issues are associated with conflicts of interest in healthcare? Answer: conflicts of interest in healthcare can lead to several ethical issues that undermine the integrity of medical practice, including patient trust and autonomy. Conflicts of interest can erode patient trust in healthcare providers. If patients perceive that their physicians are making recommendations based on financial incentives rather than their best interests, it may undermine their autonomy in decision-making. Transparency about potential conflicts is crucial for maintaining trust and empowering patients to make informed choices regarding their care. Quality of care. Conflicts of interest can compromise the quality of care provided to patients. For example, a physician with financial ties to a pharmaceutical company may be more likely to prescribe a particular medication, even if it is not the most appropriate choice for the patient. This situation can lead to suboptimal treatment decisions and may result in patients receiving unnecessary or ineffective treatments. Professional integrity. Conflicts of interest can challenge the professional integrity of healthcare providers. Physicians are expected to prioritize patient welfare and adhere to ethical standards, but financial incentives may influence their clinical judgment. Research ethics. In research settings, Conflicts of interest can lead to biased results and unethical practices. Researchers with financial ties to industry sponsors may be incentivized to produce favorable outcomes, compromising the integrity of scientific research. Rigorous ethical guidelines and peer review processes are essential to ensure that research is conducted transparently and without bias. Policy implications. Conflicts of interest can also have broader implications for healthcare policy and regulation. Policymakers must be aware of potential conflicts when formulating guidelines and regulations to ensure that patient interests remain at the forefront of healthcare decisions. How do cultural competence and humility contribute to ethical healthcare practices? Answer: cultural competence and humility are essential components of ethical healthcare practices as they enhance the quality of care provided to diverse patient populations. Understanding and respect for diversity. Cultural competence involves recognizing and respecting the diverse backgrounds, beliefs, and values of patients. This understanding allows healthcare providers to deliver care that is sensitive to individual needs and preferences. By appreciating cultural differences, providers can avoid misunderstandings and foster respectful patient-provider relationships, ultimately improving patient satisfaction and outcomes. Effective communication. Culturally competent providers are better equipped to communicate effectively with patients from various backgrounds. This includes understanding language barriers, nonverbal cues, and culturally specific health beliefs. Effective communication is crucial for obtaining informed consent, accurately diagnosing conditions, and ensuring that patients understand their treatment options. Reducing health disparities. Cultural competence can help address and reduce health disparities experienced by marginalized populations. By recognizing the social determinants of health and tailoring interventions accordingly, providers can work to improve health equity. Understanding cultural factors that influence health behaviors can lead to more effective prevention and intervention strategies. Cultural humility. Cultural humility goes beyond competence, emphasizing an ongoing commitment to learning about and understanding the cultural context of patients. It involves recognizing one's limitations in understanding diverse cultures and approaching patient interactions with openness and a willingness to learn. Ethical decision-making. Cultural competence and humility contribute to ethical decision-making in healthcare. Providers who are aware of cultural factors can make more informed decisions that respect patients' beliefs and values, leading to ethical and person-centered care. What are the ethical implications of genetic editing technologies, such as CRISPR, in medicine? Answer: the advent of genetic editing technologies like CRISPR raises several ethical implications in medicine, including safety and efficacy. Ethical concerns revolve around the long-term safety and efficacy of genetic editing. While CRISPR holds promise for treating genetic disorders, potential unintended consequences, off-target effects, can pose risks to patients. It is crucial to establish rigorous testing and regulatory frameworks to ensure that genetic editing interventions are safe and effective before being widely implemented in clinical practice. Consent and autonomy. The ethical principle of autonomy requires that patients provide informed consent before undergoing genetic editing procedures. However, the complexities of genetic editing may make it challenging for patients to fully understand the implications of the procedure. For germline editing, modifying genes that can be passed to future generations, ethical considerations become even more complicated as future individuals cannot consent to changes made to their genetic makeup. Equity and access. Genetic editing technologies may exacerbate existing health disparities if access is limited to certain populations or socioeconomic groups. Ethical considerations must address the potential for creating inequalities in healthcare, with affluent individuals gaining access to advanced treatments while marginalized groups may be left behind. Potential for designer babies. The prospect of using genetic editing for non-therapeutic enhancements, such as creating designer babies, raises significant ethical questions about the implications for society. This could lead to a new form of eugenics where certain traits are preferred over others, potentially fostering discrimination and societal divisions. Impact on genetic diversity. Widespread use of genetic editing may impact genetic diversity within populations. Ethical considerations must include the potential consequences of reducing genetic variation, which can have implications for the resilience of populations to diseases and environmental changes.